this is for the multi-target CAR-T and CAR-NK, cell engineering. We have multiplexed serial transfection, especially with mRNA. Yes. Today I'm going to introduce the non-viral CAR immunotherapy briefly and with the background of electroporation. And today's topic is CellShot partitioned flow electroporation technology, and with the key POCs and the CellShot platform introduction. And finally, as Dr. Bag introduced, we're going to visit next week Johns Hopkins site to land our system for demo and for the cooperation. And next year, we're going to find out the colleagues to cooperate with FEMTOBIOMED and our the group to apply the governmental funding. Okay. The global biopharmaceutical market is quite large these days, and it is similar to the semiconductor market. And the subsectors of biopharmaceuticals are 5. Among them, the cell and gene therapies are shares small amount of market, but it is growing very fast. So CAGR over up to 50%. So cell and gene therapy is fast growing with high earning. However, there are many needs of viral vector in CGT. That is, it is high cost and low productivity, and the second cancer risks due to the viral vector transduction. As the modality of the drug develops, the production cost exponentially increased. So the cost of the CGT is roughly about 100,000 times more expensive than small molecules. The reason is the manufacturing cost. The example is autologous CAR-T cell therapy. The more than 50% is the manufacturing cost. And this year, FDA investigates the serious risk of secondary cancer following CAR-T treatment. So in 2022, we found that the KITE group started non-viral mRNA-based CAR-T programs of the 10s. They use MaxCyte system. So now, the non-viral and multi-target CAR immunotherapy becomes more important, especially for the CAR-T and CAR-NK for solid cancer. I think all we know that multi-target and multi-dosing CAR strategies would be very promising and effective. They can solve the issues of tumor heterogeneity, immune escape and antigen escape, and the short lifespan and poor persistence of NK cells and resistance to viral induction of NK cells, something like that. However, manufacturing multi-target CAR is very challenging, and multi-dose strategies will amplify the cost of treatment as much. So we need some innovation in manufacturing the strategies. So after the COVID-19, we think that mRNA-based EP transfection would provide feasible solutions. So many solutions are now on the market. However, there is some, before starting what is electroporation? We need to know the background of electroporation. Electroporation is the process of giving electric damage to cells for gene delivery. So we apply higher field that gives more damage, and we get more intracellular delivery. So the health of cells would be the most important for the cell to withstand higher E field. However, there is fifth of the electroporation, that is washing. Washing is a must for electroporation to remove the many enzymes and unknown chemicals in culture media. For example, RNAs and DNAs are destroy mRNA DNA in culture media. So in order to deliver mRNA, we need to wash the cell to remove the RNAs in the cell media, and we switch to the electroporation buffer. However, that washing process weakens cell health, and some cells would disappear, and that leading to poor transfection performance. Our technology, the CellShot partition flow electroporation, removed the process of cell washing. So we think it's innovation. So no washing and no mixing. However, without mixing, the transfection never occur. So we invented the PFEP technology that gives three forces on cells to move from the cell flow to the material flow. For these technologies, we use a microchip, and it is very small scale. So the radial number of this flow is very small. So it's quite a laminar flow. So this flow doesn't mix. So no mixing occurs. So there's no way to occur a transfection without move cells to the material side. So our technology, by the three forces, moves only cells into the mRNA flow, the material flow. So the enzymes like RNAs and DNAs in cell culture media doesn't move. So the mRNA and DNA in material flow doesn't damage, doesn't have any damage. So only cells move, so we can get very nice transfection and without washing cells. That is the innovation, I think. I will enter some small.
The PFEP technology does not mix cells with genetic materials. Thus, traditional EP buffers, wherein cells and materials are mixed, are no longer necessary. However, without mixing them, transfection will never occur. The key innovation is that only cells migrate into the genetic material flow by three forces acting on cells, leaving RNase and DNase in the cell flow, not allowing mRNA and DNA damage. Thus, cell washing is not required, which is key for significant yield improvement. And many commercial or in-house buffers can be used for your genetic materials where the transfection occurs.
Yeah, so if we review the traditional EP process, that the significant yield decrease occurs due to the cell washing. This is an example. So to make a transfection, we must wash out cells, and we should switch, the cell media to electrolyte buffer, and then we add up, DNA or mRNA to mix them up, and then we apply electric field to occur electroporation. When we calculate the efficiency of the transfection itself, the efficiency would be very high because the cell loss and damaged cell doesn't account to calculate the efficiencies. But if we see the entire process, many cells, just disappear before start, transfection. So entire load, entire yield decreases a lot due to the cell washing. The partition flow electroporation, we do not wash the cells, so all the cells go to the transfection. So transfection itself also have high efficiency and high viability. So there's no cell loss, no damage. So the entire process gives us very high yield. So that's the great point of the innovation point of the PFEP. And because this high yield, we can we can do multiplex serial transfection. Okay, let me show you some POC data about that. First, thing is that the transfection efficiencies and yield is very high with even primary immune cells. One data is that primary PBMC, we transfected EGFP. So EGF mRNA is transfected to the primary PBMC, and we found out that the viability exceeds 9% and efficiency also is 9%. But this is one example of our POCs. We tried many primary PBMCs, but it was imported from the Europe to South Korea. So half the PBMC samples have bad and poor viability. So anyway, if we have a nice healthy PBMC, so we found out that the viability is very high and efficiency is also very high. And next POC example is the human NK cell line transfection results, and we get this data from our the certificate. So we got the efficiency exceed 96% with the viability of 95. So it's very high. And another example is the CAR NK. We made CAR NK out of CA19-9 mRNA. And we found that for the primary NK, it took about 5 days to have fully expressed. And we found that the viability, we have 4 cases, and the two best cases showed us that the viability exceeds 90 and efficiency also exceeds 90. And another 2 cases showed us that about 75% of efficiencies with 90% viability. So we found out that even primary immune cells, the PFEP transfection showed, very high performance.
Okay. First, multiplex serial gene transfection is possible. High-yield PFEP transfection allows up to 4 times serial transfection with cell viability of over 80% or higher. The removal of cell washing, causing significant cell loss and damage, mainly enabled multiplexed serial transfection. Double serial transfection of EGFP and CD19 SAR was also clear, wherein each signal of EGFP and CD19 was equivalent to single transfection of each.
Second, the feature of PFEP that users can select diverse cell media and buffers for genetic materials is huge benefit for safety, cost, and CMC. Regardless of the kind of cell media and material buffers, basic performances are almost equivalent.
Well, yeah, the movie showed that the serial transfection is quite nice when we use our partition flow electroporation. It is because the yield is very high. Even though we repeat the transfection, after 4 times, we found that 25%, yield we can have is very high, and it's quite high yield to satisfy CMC of the cell self-manufacturing. This is another example that we made, CD19 CAR NK, and we found out that it has very high expression efficiencies and with high cytotoxicity. The expression was checked out the anti-FMC63 antibody, and we found out that roughly, higher than 80% was expressed. And because the humanized NK cell line has very fast, expression rate and fast expansion rate, we just tested 18 hours cytotoxicity with, the normal, NKs. They found that, after 18 hours, roughly more than 80% of NAM6 cells were dead. So we now test making this, CAR NK, POCs to have some mouse model to the results for the mouse model. That's for the the good evidence for our customers to apply this technology to their pipelines. Okay, next page, I will briefly introduce the products of the CellShot system. The CellShot system, this is a second generation. We launched this model this year, and it have FDA, Drug Master File, and it was effective from August 1st this year. This machine has several nice features, but the important part of the feature is the cooling, cartridge cooling. And also it has some sensor and database, something like that. So to the system, we put this cartridge. The PFEP technology is in this cartridge, and as you see this, the figure, the glass microchip here is the main site of transfection, partition flow transfection. There are two inlets for the material and cell, and there one outlet. And inside this channel, the transfection occurs. So this version uses syringes to contain material and cell, and to contain the harvest. And now we are developing the cell-based, machine that's going to be available next year. Okay. There are several, non-viral electroporation systems on the market, and we found that the MaxCyte is the first one having a master file in 2002, I think, and the second one is the FEMTOBIOMED CELLSHOT system. We have relatively easier, situation there because we don't use, electroporation buffer. So the biocompatibility, certification was easier than other systems because they use, electroporation buffers. So they must open up the content of their buffer and the cytotoxic free results out of their EP buffer. So there are many nice, electroporation buffer systems, but they all uses electroporation buffer, and they need to wash out cells, and they need to mix up the cells with genetic materials to perform transfection. Only our system do not use EP buffer, or we do not wash cells, and we do not mix cell and genetic materials. So I think our system is quite, exclusive than other systems. Okay, these features can simplify the transfection, processes, and also it can give us, higher yield. So I think it's quite, advantage of our system, but we need more, stories and brands and POCs and field data. So that's a weak point of our systems because we are new players in the market. Okay, as we told you that we're gonna visit Johns Hopkins, next week, and we plan to land our CellShot system in 21. So I think it's a JHBIC, site, and so anyone can visit to see our system, and sometimes you can test our system with your cells and materials. We're gonna provide cartridges and EGFP mRNA. So if you want to test your cells and your transfection with the FEMTOBIOMED CELLSHOT system, then just you can plan to do some demos in the site. And the reason is that this system is commercial, but this is not for medical device. This is for the GMP production system, and the collaboration is intended to make some medical device based on the CellShot PFEP technologies. We're gonna cooperate with Johns Hopkins and the Catholic University of Korea in South Korea, and TerraBest and Valid to commercialize this medical device. So we are looking for researchers in Johns Hopkins to join this program. The concept is that we use it. We start from the leukapheresis. We harvest the white blood cells, and we isolate PBMC or T or NK out of the white blood cell of the leukapheresis. Then the cells directly go into the CellShot PFEP system, and then we put some mRNA for some specific target the patient needs to be treated. And then the outcome of this system doesn't have any toxic material. So we hope to directly infuse the outcome to the patients. But now it is not easy, but we need to cooperate to develop the system having this concept. So the next week visit, we're gonna discuss about this concept and how to cooperate and how to compose our symposium of this research topic, and also we're gonna explain our system too. Okay, so this is concept of the the operation cooperation with the Johns Hopkins. Okay, thank you so much today's your hearing of our system, and any question feel free to ask. Thank you.